Ladies and gentlemen, please welcome Holly Kuzmich, Executive Director, George W. Bush Institute, Mamadi Yilla, Acting Deputy Coordinator for Multi-Sector Relations, U.S. Department of State, Office of the Global AIDS Coordinator and Health Diplomacy, Shannon Hader, Deputy Executive Director, Program, United Nations Program on HIV/AIDS, and Carmen Villar, VP Social Business Innovation at Merck.
Well, good afternoon, everyone. It's great to see you all. I've got a distinguished panel here today, as you just heard, in three experts in the field with Mamadi, Shannon, and Carmen. We're excited to be here today to really dive into a couple of key issues. Number one is the importance of public-private partnerships. And number two is a focus on women and girls. And all of my panelists here attend to both of those through the work that they do either at UNAIDS, at Merck, at the State Department through PEPFAR. And one of the particular ways that we all work together that we're going to talk about today is through a program called Go Further. Go Further is really a partnership among the George W. Bush Institute, PEPFAR, UNAIDS, and Merck. Earlier this year, we added Roche to this partnership. And it's really about layering on cervical cancer screening and treatment to the PEPFAR program. We all, I hope, know about the success that we have seen under PEPFAR since 2003. And about 10 years ago, the Go Further partnership started to really layer on that cervical cancer prevention, screening, and treatment. Because we know that women living with HIV are at increased risk for cervical cancer. And so it made sense to really add this on. It's the right thing to do. We're protecting the investments that the American taxpayers have made in PEPFAR, but we're giving women living with HIV the opportunity to thrive. And what's so unique about this and so many of the public-private partnerships that PEPFAR has been involved in is the unique experiences and assets we all bring to the table. And that's what I want to dive into with our panel a little bit today. Mamadi, thank you for being here. First, I would love if you would talk to the audience a little bit about Go Further, this initiative we started 10 years ago among these partners to really bring in cervical cancer prevention, screening, and treatment to the PEPFAR platform. Where are we today in terms of our ability to screen for cervical cancer in the countries we're working in?
Thank you so much. It's my pleasure to join Shannon and Carmen on this forum today. I'm going to ask you for just a minute to say thank you to Matt Swift and Concordia for hosting us, to the Bush Institute for being really the soul of the Go Further partnership. Merck, we are proud of your work, not just with us here in Go Further, but as many of you know, tomorrow the US government will host a global COVID summit that at its core is multi-sectoral partnership, which is exactly what the Go Further partnership is about. And Merck has been involved in COVID therapeutics and expanding vaccine availability. So I want to say thank you for that. And then I also want to just quickly acknowledge our PEPFAR colleagues around the globe who have demonstrated unbelievable resiliency, including in the work that we do in cervical cancer off the PEPFAR platform throughout the last 18 months, despite the setbacks and disruptions that COVID has unleashed. And to Holly, to your specific comments about leveraging the PEPFAR platform, the audience may know that we have utilized the PEPFAR platform to offer services to our HIV women who are 6 times more likely to develop persistent precancerous lesions and progress to cervical cancer, oftentimes more aggressive and higher mortality. And so the fact that our platform has been leveraged to deliver services for these women has been just outstanding, an outstanding use of the platform. Yesterday, a colleague described global health as being about complementarity and cooperation. There's no better place to realize that in our partnerships than to go further collaboration. Our strategy in PEPFAR is to further capitalize on private sector capacities and investments, and more than 2 million cervical cancer screenings have been performed by the Go Further partnerships between 2018 and March of this year. And that's despite COVID and other challenges. 5 of the original 8 Go Further countries met at least 80% of their screening target in the fiscal year, and we have expanded from 8 to 12 countries. So I'm going to turn over back to you for to hear more from Shannon, who also wants to weigh in.
So Shannon, can you talk a little bit about the UNAIDS role in Go Further, and particularly your lens on women and girls at UNAIDS?
Yeah, absolutely. And without drawing it out, just want to echo Mamadi's thanks and celebration for this tremendous partnership and all the partners from Concordia hosting. And we haven't seen each other in person for the 2 years since we were last at UNGA together. We were noticing before we started to, of course, the Bush Institute, PEPFAR, Merck, and we welcome new partners as they come. You know, it's interesting because we have at UNAIDS has spent the year really developing and launching a brand new global AIDS strategy for the next 5 years. And it would be, I would probably be exaggerating if I said Go Further totally informed everything about the strategy. But I do think some of the core elements of the strategy are amazingly exemplified by what we've achieved together at Go Further and what we have left to do. And I think a few things from UNAIDS' perspective are critically important. One, this new global AIDS strategy is based off of an inequalities frame. It recognizes, you know what, we're doing really well in some of the HIV response, but how well we're doing is incredibly uneven. It's unequal across countries, within countries, across populations, and for multiple different intersecting regions. And we've talked for so long how cervical cancer and HIV are both diseases of inequalities, and they both suffer from gender inequality on top of inequalities in income, in geographic location, in risk. And so we think this frame really helps to highlight some of the solutions going forward if we choose to look about who's next, who's not benefiting from how we're delivering now. And Go Further gave us a lot of experience and is still delivering on how to reach those women that weren't already being reached. And that gets us a little bit to the second part of the strategy that's really important, which are the targets. So for the first time, you know, everybody heard about the 90-90-90 treatment or service targets for HIV. But we've not only upped the idea that people living with and at risk for HIV should have 95% access to services, but the reality is we say that can't just be a national or a global average. We've got to really disaggregate. We've got to look at who's being missed. And when we look country by country, we might find, for example, that women in general might be reaching treatment services a lot, but it might be women who are sex workers or women who are in a certain place are not accessing them at the same level, and they're hidden unless we look for this. And so these targets not only focus in on how do we know where the disparities are so we can solve them, but they also focus in on this idea of integrated services. So building right on what we've proven in Go Further matters, which is, you know, how can 90% of women living with HIV get cervical cancer services alongside their HIV services? There's a hardcore target on that now. But we've also introduced some new quantitative societal enabler targets that talk about the rest of women's lives that get in the way if we don't address them. You know, so we want less than 10% criminalization that keeps women from accessing services. So, you know, whether it's sex workers or women who use drugs, we know they're not accessing these kind of services the way we need to. We want less than 10% gender-based violence, and we want, you know, less than 10% stigma and discrimination. And finally, and I think we'll talk about more of this as the panel goes on, we also really highlight the role of community-led agency leadership, delivery, and, you know, assessment in making the change. And I think the spirit of Go Further, which has really relied on the voices of women to tell us how to do this and what's needed and is it working or not, really informed and is well represented in sort of our new perspective for the next 5 years overall.
So Carmen, at Merck, you know, you're one of the private sector partners in this partnership. Talk a little bit, how does Merck think about their approach to public-private partnerships and your motivation for where and how you involve the company?
Sure. And thanks, Holly, and thanks everyone. And I just want to point out to everyone, I'm not going to repeat all the thank yous, but I do want to say, point out that this is a tremendous group of powerful women on this panel. And I think it exemplifies one of the important reasons that Merck has entered into this partnership, a Go Further, to really try to address the issues related to HPV infections and HIV co-infections. We know that the burden of HIV/AIDS is particularly acute for adolescent girls and young women in Sub-Saharan Africa, who account for 74% of new infections in young people. And think about this, we know that every day, 1,000 adolescent girls and young women are infected with HIV. And then we compound these challenges, right, with women living with HIV who are 5 times more likely to develop cervical cancer. This was a call to action for Merck. This was a no-brainer. I mean, we have a long history of entering into public-private partnerships, but we also have this commitment and over 130-year history of developing, using our R&D, our innovation, our skills to develop new medicines and new vaccines. So as we have done that over time, we have also realized that we can make commitments to improve global health by getting involved in key partnerships where we are addressing things like river blindness with our Mectizan donation program, or Ebola with the development and getting over the finish line with our vaccine there. HIV in the early days with making our making Crixavan and making the formula for that available publicly. And in this case with HPV, we really knew that we could potentially make a difference by learning more about the interface scientifically between HIV and HPV, and therefore really advancing the care for women globally and trying to address some of these disparities. It has been a real pleasure and an honor to work with all of the partners you see here. We know that with the knowledge we are learning, that we can ultimately empower adolescent girls and women with the information and the tools to protect their own health and their futures. We know that women are at the center of much of the care that is provided within a community or a family. And it's incumbent upon us to help make a safer environment, a safer world, and better health outcomes for women and girls. And so, like I said before, we're committed to collaborating with our global stakeholders to drive progress in any way we can. And this was indeed a no-brainer for us.
Yeah. So Mamadi, I want to turn back to you and PEPFAR, because you all are developing your next strategy through 2025. And I know this role of partnerships is a big topic of discussion for you. You all have obviously evolved as a program in terms of how you use partnerships. And Shannon also raised this issue of community-led delivery. Can you talk a little bit about your strategy, what you've learned on those issues, and how that's informing your work going forward?
Yes, thank you, Holly. So PEPFAR is in the midst of hosting, where we just concluded hosting a number of listening sessions with our vast array of our partners to kind of improve on the goals that what it will take to sustain epidemic control in the countries that have achieved that, and in the countries where there's still work to do. And partnerships has been central to our success thus far and moving forward. I want to just tell you a little something that really impacted me recently. One of the young women in my life, I'm privileged to raise 3 of them, spent the last 3 months of the summer before her senior year talking to women in the Western area of one of our countries, staying in conversation, in observation, in learning mode about how women use informal networks to find and meet their healthcare needs. And it reminded me of how much better we are when we speak to the clients about what it is they want. And when we ask them directly. That was something that we gained out of our private sector relationships within PEPFAR. More than ever convinced that honesty in our partnerships is a key driver to achieving sustainability. We saw that during our COP planning meetings. We heard from our stakeholders that when it comes to how PEPFAR helps deliver cervical cancer services, there is that big thing that we've done a tremendous amount of screening, but treatment is a key need. And so how do we bring new partnerships into the fold to help address that? Because even if we are not the ones who are going to pay for it, it has to be supported. Women have to be supported to get the needed treatment that they desire. So I would say that we are that core tenet of PEPFAR from our founding legislation, our experiences in getting countries to epidemic control have shown us that there are things that we do better when we partner. And I want to tell you one last thing before I move off that it is because of our partnership with the Bush Institute and UNAIDS that we've amplified this issue globally. It is because of our partnership with Merck on HPV vaccines that we have been able to expand primary prevention of cervical cancer as part of our support to countries in their core delivery system. And now, of course, as you mentioned, the new partner Roche, we're hoping through them for a stronger understanding of the patient journey and client-centric needs of our population. So over to you, Holly.
Shannon, I'd love to know from the UNAIDS perspective where we might have other opportunities to focus on women's equity through things like this, sort of this multi-sector, multidisciplinary approach that we've been talking about and that Mamadi just emphasized. What opportunities do we have?
Yeah, well, I think let me expand a little bit more on how important community-led and really women-led organizations, not just women alone, are, and how that taps into some of the multi-sectoral areas where we can find both more women to execute, activate, and get engaged, but also other sectors where we can do better. When we talk about women-led organizations, we mean organizations led by women for women. Simple as that, whether they're women living with HIV or other groups of women who have things in common, who have organized for change. Building on what Mamadi just said, the importance of the sort of multi-sectoral life insights that women-led organizations bring to help us deliver what we want can't be underestimated. And it's not some big nebulous thing. If you think about it, what do women need to really make the most of our cervical cancer interventions? They need the knowledge and the capacity to decide. They need the support from stigma, from fears, from isolation as they go into a cancer journey. They need the practical and the logistical and the design elements that make it feasible and easy to reach and access the services they want. And importantly, they need, frankly, options and choices. And women-led organizations can be strong proponents of all of these factors, including the options and choices. The option to know that if you're diagnosed with cervical cancer, whether it's early or late, there's something you can access and do about it. The option to increasingly move from, medical or facility-based early screenings to self or accompanied screenings. So one is really tapping into that intelligence. And when we look across other parts of our health sector and other sectoral groups, I think we have to both figure out how we leverage and learn, but also we have to look at how do we lift together. We've done a great job of integrating cervical cancer into HIV services, and it's based on that option and choice. And we got that idea of options to meet women's needs really in oftentimes family planning services a long time ago. Yet sometimes when we go out there, we find that in our broader health services, those options and those choices aren't always available. And we need to lift up those standards and bring them together and really keep an eye on how do we have the economic supports and opportunities? How do we have the safety from violence? How do we have the education and decision-making capacity that women are supporting each other on and being supported for, so they really can move all of these forward together?
Thanks, Shannon. Carmen, I want to ask you about one of the other significant public-private partnerships that Merck is involved in, and that's Merck for Mothers, which you're celebrating your 10-year anniversary of the work you've done there. And I'm particularly interested in knowing, the importance of this work that you've done and the overall sort of learnings for you all in terms of strengthening health systems overall to better serve women.
Yeah. Thanks, Holly, for that question. We did have a great celebration last week. We first launched Merck for Mothers 10 years ago at the UN General Assembly, and really with our goal to help contribute to SDG 3.1 to reduce global maternal mortality. And that was our commitment then, and we have made much progress since then, and I'll talk about that in a second. But again, I just want to remind everyone, or for people that may not know, globally, every 2 minutes, a woman dies from complications related to pregnancy and childbirth. In the US, roughly 3 times more Black women die in giving childbirth than their white counterparts. Most of these deaths are preventable, and when women have access to quality maternal care before, during, and after childbirth, we can definitely prevent some of these deaths. Through our diverse collaborations, we have made progress in having an impact on women's lives, and at the same time strengthening health systems for sustained impact on how healthcare is delivered. For example, we've invested with the WHO and Ferring Pharmaceuticals in research to show that a heat-stable PPH drug, a heat-stable carbetocin, is just as good as the current standard of care, which has to be delivered through a cold chain. So uncovering technologies that can be made available to women where you don't have to worry about something at a certain temperature can be delivered to women anywhere in the world is one example of an advancement. We've done a lot of work in India with the Ministry of Health and but in particular with private providers to improve the quality of care and make sure that a woman is respected and given the information she needs to make important decisions about herself, her pregnancy, and her childbirth. It really is, as I mentioned before, a pathway to a lifetime of good health for women, and that ensures good health for their babies and hopefully the rest of their families. Our programs at Merck for Mothers have touched or reached over 13 million women. We have provided training for close to 300,000 providers, and really 78 million people have been reached through improved access to quality facilities. And I think that's really the point when we're talking about health system strengthening and sustainability. We can go in there and then we can leave in a few years and we can execute on programs and meet certain KPIs, et cetera. But if we don't really work hand in hand with governments and local providers to make the systems work, to make them better, as PEPFAR has been doing for a long time, then we are not going to be able to sustain the progress that we've made. So that is our commitment. And I know that is our commitment with Go Further as well.
Great. Mamadi, I want to ask you one final question. We, of course, I want to ask about COVID and, of course, its effect on the global response to HIV. What you've seen in PEPFAR, it's obviously been a challenge everywhere around the world, but I'm also particularly interested to know how this issue of strengthening health systems that everybody's been working on has also led to a potentially different response than we might have seen, 20 years ago.
So, Holly, yesterday we published an article that really actually lays out what we've been doing here at the PEPFAR program over these last 18 months to address the COVID pandemic. And I think that over these 18 months, we have leveraged the health system that PEPFAR helped countries build to deliver on HIV services for much more than just HIV. We have had lots of disruptions, backsliding, but we have rallied we have absolutely rallied to actually help countries address COVID at the same time as combating HIV/AIDS. And I don't think there is any better proof for the investment that we've made in the health system in many of the countries that we work in that have delivered for COVID. So whether it is the health system, the workforce, vaccine readiness, now helping get vaccines into arms, we're all in. Because we know that we cannot actually sustain our HIV gains without addressing what we're all confronting right now. So direct you to look for that to see some more details on what's been happening in the PEPFAR program. And what a privilege to be here. Thank you, Holly.
Yeah. Well, Mamadi, Shannon, and Carmen, thank you all for being here today. Thank you for being part of this discussion. I know that the work we all do together is so much more powerful because of the fact that we do it together than trying to do this individually. So I'm grateful for your all commitment, and thank you to Concordia for having us today.
Thank you.